Hey guys, Frank Garza here with Pure Physical Therapy, and just want to reach out to everybody and give you some information, answer some questions that I've been asked. And I've been asked a very common question here in the last week from three different individuals, and that was, "Hey Frank, how do I know if I or somebody that I know is suffering from a frozen shoulder?" So the purpose of this video is to provide you with some self-tests that you can do at home to identify this particular syndrome or diagnosis, and then of course give you some advice on what you need to do to get it properly treated. So, have you ever like woke up one day all of a sudden and just couldn't put your hand behind your head? Maybe you couldn't reach behind your back to put on your bra or take off your bra or put on your pants. Um, had a lot of increased pain in your shoulder with putting on like a t-shirt or even things like brushing your teeth or washing your hair. That's a lot of what I hear commonly in the clinic of some of the patients that come in with frozen shoulders. So, if you struggle with some of those daily activities, there is a good chance that you may be suffering from a frozen shoulder. But I want to tell you what you can do at home to try to identify this, and then, of course, what you should do if this is you. So, when somebody comes into me here at Pure Physical Therapy and they're talking to me about their shoulder pain, one of the next things I do is test their range of motion. So I ask them to do certain movements of their shoulder to identify a specific pattern that most frozen shoulders have. So first test that I would have you do is, try to raise your arm up as high as you can. Okay, and if you have pain at a certain movement, stop and note the quality and the degree of that range. Okay, and then of course compare it to the other side. The other side may be full and normal. This is full and normal, and maybe you're limited with pain here, and that's okay. So that's the first thing you do. The second thing you would do is come out here to the side and note that range and pain. And what you're going to find is that maybe you cannot lift your shoulder as higher here compared to here. Okay, but what is normal here should be this in this position. And then the last thing I want you to do is try to reach behind your head with the arm that's affected, and then try to reach behind your back. And what you'll find is that this motion here, or maybe this motion here, is the one that's going to cause you to have the most pain, most discomfort, and you're going to notice that you maybe are struggling to do that motion the most. So those are the three tests that you could do at home. If you find that you have limitations in all those three, and this one here and this one here are the most limited compared to the others and give you the most pain, then there's a high chance that you have a diagnosis of a frozen shoulder. And one of the things you can do to relieve it or to get on the path to natural healing is seek out a physical therapist for further evaluation. The treatment consists of a lot of hands-on manual techniques to really loosen up that joint capsule and restore your range of motion back. And then we work on your strength to get it better. But once you go to a physical therapist, they can identify what stage of a frozen shoulder you're in, and I will briefly name those here. There's the pre-freeze phase, there's a freezing phase, there's a totally frozen phase, and there's a thawing phase. And that's important for your physical therapist to know so that they know what treatment plan to initiate with you going forward and get you to where you need to be. So again, that's a little stuff on the three things you can do to identify a frozen shoulder. Coming to you here from Pure Physical Therapy in McAllen, Texas. If there's anything that we can assist you with, just please don't hesitate to email us at info@pure-physicaltherapy.com or just give us a call at 956-994-8880. Thank you and have a good day.